Okay, so today we're going to discuss all about the disorder related to your primary hemostasis. So again, our primary hemostasis includes here your blood vessels and our platelets. So this topic will be discussing about problems or disorders related to your blood vessels. And we have also here the disorder related to our platelets. Disorder related to your platelets could be in the form of your qualitative or could also be quantitative. So first we discuss the disorder related to your blood vessels. Okay, so we have here your vascular disorders. So the first one, we have your hereditary hemorrhagic telangiectasia. So this is other name for that is your Osler-Weber-Rendo disease. So this disorder here characterized by very thin blood vessels because of this continuous endothelium. We have also here inadequate smooth muscles and we have also here inadequate connective tissues, making that one as highly fragile na blood vessels. Since very thin ang blood vessel na patient natin, so the patient would have here high tendency of bleeding manifestation because it's very sensitive na blood vessels to trauma. This Osler-Weber-Rendo disease here is inherited here as autosomal dominant. The next one, we have your hemangioma thrombocytopenia syndrome. So this is characterized by a giant hemangioma, parang malaking bukol na nangingitim. And this is very prevalent among young children. Other name for that is your Kasabak-Merit syndrome. So it's because here the one who try to recognize this disorder is Kasabak and Merit. So I think they are pediatrician. Okay, and your giant hemangioma is associated with your disorders like your DIC, disseminated intravascular coagulopathy, and we have your microangiopathic hemolytic anemia. Okay, the next disorder, we have your Ehlers-Danlos. Ehlers-Danlos is characterized here by hyperflexibility of the skin. So, sobrang flexible ng skin ni patient. And that's just like mga, in the case of your contortionists. Okay, so this is primarily because of abnormality in the production of the collagen with the synthesis of that and of course here the cross-linking of your collagen. And therefore, hindi na cross-link. Nagpaproduce siya ng collagen, but the collagen here is not being cross-linked. Pag hindi na cross-link ang collagen, what you have here would be eventually, hindi siya ganun ka-stable na fibrin, connective tissue, or collagen na connective tissue. And therefore, ganun, flexible ang skin ng patient. Kasi since hindi nagko-cross-link ang ating collagen, hindi ganun ka-firm ang kanyang connective tissue. Number 4, we have here your Henoxion lame purpura. So, Henoxion lame purpura here is just allergic reaction with the presence of its rashes, with the presence of red small spots in the skin of the patient. So, parang may butlig-butlig na, okay, na reddish in color. And your Henoxion lame purpura is a type of purpura here associated with your immune complex, with the deposition of your IgA immune complex. Number 5, we have your paraproteinemia. So this is characterized here by increased concentration of your paraproteins. So just in the case of your multiple myeloma, Waldenstrom macroglobulinemia, and increased paraprotein inhibit your fibrin polymerization. What is a fibrin polymerization? As we go back here with the basic process where your fibrinogen is converted to your fibrin clot, to form here a stable na clot, dapat ang clot natin should be stabilized, polymerized by factor 13. So, pag wala kang factor 13, hindi siya ma-polymerize, or at the same time, pag meron kang paraprotein, it try to inhibit here the polymerization of your fibrin clot. And therefore, what you have for that, hindi rin siya magkakaroon ng stable clot. And therefore, the patient will also have here a bleeding tendency pa din. Next one, we have your amyloidosis. So, amyloid, we consider this one as your abnormal protein with alteration in the secondary beta-pleated sheet structure of your protein. Amyloids is a toxic protein. Kung saan ito nagde-deposit sa katawan natin, sinisira niya ang tissue kung saan siya nakadeposit. If your amyloid, try to deposit here in our vascular wall of our blood vessels. So try to damage that one, the patient would have here hemorrhagic tendency. Okay, another disorder related to your blood vessels, we have your senile purpura. So senile purpura, very common among old age sa matatanda. This one characterized here by the lack of collagen support and primarily because of lack of the subcutaneous fats. So remember here, you've noticed pag matatanda na, so parang nagsasag na ang kanilang, di ba, ang kanilang skin, wala na masyadong fats doon sa loob. And therefore, that would have your very sensitive then na mga blood vessels. And therefore, they are prone here to the trauma. So, madali silang, like if you try, for example, for the old age, if you try to inject, or for example, if you try to hit that one, their vein, with the skin, with their vein, with the needle, for example, when you're doing your blood extraction, madali siyang mangitim. Okay, that's your senile purpura because of the lack of elasticity of the skin. Okay, then we have also here your drug-induced purpura. So, this is also here the presence of the red small spots on the skin, just like your Henoxion lane purpura. Only that your drug-induced purpura here is induced by drug administration. Then that's, for example, we have here the intake of your aspirin, your barbiturates, your warfarin, your diuretics, your sulfonamide, we have also your iodide. So if the patient, for example, here would have the presence of red small spots on the skin, if you are doubting or confusing here if that one is your Henoxion purpura or drug-induced, all you need to do is just ask the history of the patient. So kung nag-take siya ng drug, so of course, that's drug intake. Pero pag wala siya tinitake na drug or medication, then red small spot may be, of course, that's purpura related to your henoxion lane. It's immunoglobulin. I mean, that's immune complex deposition, not your drug-induced. Then we have here miscellaneous. The first one, we have here vitamin C. Vitamin C deficiency is your scurvy, other name for that. So, most likely, pag kulang ka sa vitamin C, most likely nagpo-prone ka sa bleeding manifestation. Like, for example, most likely, nanonotice ito pag nag-tooth extraction ang patient natin. So, the dentist would just prescribe the patient with the vitamin C to help here on the patient to have, because of course vitamin C here would eventually be lacking or deficient of patient, so the patient would have to also have the bleeding tendency. That's scurvy. Another one, we have your purpura simplex or vascular fragility, parang namamasa, may karoon ng pasa ang patient. Only that your purpura simplex or vascular fragility, so fragile na blood vessels, so very sensitive din na blood vessels. And that would also allow the patient here to be prone to traumatic injury. Konting nabunggo lang ang, let's say, whatever na surface, nagkakaroon na siya ng pasa agad. But in a purpura simplex, the traumatic here injury or the blackening area or the blackened area would have here a flat na surface. Hindi mo siya makapa. Flat siya. How about your ecchymosis or your bruising? So, ecchymosis or the bruising here is just the leakage of the small amount of the blood to the surrounding tissues where I try to form a blood clot. So, pasa din siya, just like your purpura simplex, only that your ecchymosis or bruising, it would have a raised na border. Pag sabing raised na border, kung itong skin na patient, so ito ang pasa niya, nakakapa mo siya. That's your ecchymosis or your bruising. So, parang nafe-feel mo siya. Pero in the case of your purpura simplex, very flat ang surface kung saan ang blackening or pasa na area. Hindi mo siya makakapa. Okay, so those are the disorder related to your blood vessels. Okay, now we go to disorder related to our platelets. So, we classify our platelet disorders quantitative or qualitative. So, pag sinabing quantitative platelet disorders, so that means here that the problem is with the platelet count. Either mababa ang platelet count natin or mataas ang platelet count natin. So, pag mababang platelet count, that's your thrombocytopenia. Pag mataas, we have your thrombocytosis. So, first we discuss the quantitative platelet effects related to your thrombocytopenia or decreased platelet count in your peripheral circulation. So, decreased platelet count in your peripheral circulation may be due to the following causes. First one, decreased production of platelets related to the decreased megakaryocyte production. Another one, normal ang ating platelet production. However, here, namamatay agad ang ating platelet in your peripheral circulation because of many conditions or prevailing na mga conditions. That could eventually be immune-mediated or could also be non-immune-mediated. Another one is increased sequestration of your platelets to your spleen. Remember that your spleen tried to sequester sa platelet, tinatago niya. And therefore, it would affects the platelet count in your peripheral circulation. So, pag madaming platelets ang sinesequester ng spleen natin, expect to have a decrease na platelet count. That's why, di ba, splenectomy, pag tinanggal natin si spleen natin, expect to have here an increase in the platelet count. Okay, the first one, decreased platelet production. So, bakit mababa ang platelet production natin? Is because number one, okay, megakaryocyte hypoplasia. So, pag sinabing megakaryocyte hypoplasia, again, your bone marrow is not producing megakaryocyte. So, since remember that your megakaryocyte is the parent hematopoietic stem cell of your platelets, so pag wala ka megakaryocyte, expect to wala ka din platelets. Another one is mababa ang platelet production here because ineffective erythropoiesis. Number one, wala ka talagang megakaryocyte. The second one, may megakaryocyte ka. However, your megakaryocyte dito sa ineffective erythropoiesis, hindi siya nagde-differentiate, nag-proliferate, and therefore wala ka din. Although you have the megakaryocyte, kaso nga lang, hindi siya nagmamature, nagde-differentiate, or hindi niya nire-release ang platelet to your peripheral circulation. And therefore, wala kang platelet in your peripheral circulation. Still, mababa pa din ang platelet count natin. That's related to your decreased platelet count production. Okay, then we have here the causes of your congenital megakaryocyte hypoplasia. So, these are the causes here why your bone marrow is not producing here your megakaryocyte. So, disorder related to that, we have here the first one, we have your Meheglin anomaly. This is characterized by mutation in the gene MYH9 gene. Another one, we have your Sebastian syndrome, characterized by the presence of your WBC inclusions. Fechner, characterized by manifestation of your deafness, my hearing defects, my visual defects in the form of your cataracts formation, and my kidney problem. Epstein, on the other hand, would have here only the deafness and nephritis. Wala siyang eye defects in the form of your cataract formation. Anyway, we'll be discussing each of one that later on when we go with your giant platelet with the thrombocytopenia. Again, these are characterized by the thrombocytopenia, mababang platelet count, pero they have a very large na platelets. So, giant platelets, but they are thrombocytopenia. Another one, we have your TAR, thrombocytopenia with absent radius. So, wala siyang radial bone. So, radius natin is diba? Radius and ulna. So, wala siya. It's congenital defects. And your TAR is also associated with the thrombocytopenia. It's also congenital. Another one, we have your Fanconi anemia. So, Fanconi anemia is a pancytopenia. So, pag sinabing pancytopenia, your bone marrow is not producing here the blood cells. Your bone marrow is not producing here not only not producing your WBC, your platelets, but as well as your RBC. All your blood cells, your bone marrow are not producing. That's why tinawag siyang pancytopenia. So, decrease RBC count, decrease WBC count, and we have also decreased na platelet count. That's your Fanconi anemia. So still, we consider this one as still your congenital megakaryocyte hypoplasia. For the mode of inheritance, you could have here your congenital megakaryocytic Okay, hypoplasia. So this is characterized by mode of inheritance is autosomal recessive, and this is characterized here by the absence of your megakaryocyte production. Ito naman sa autosomal dominant, you have a normal megakaryocyte production. Meron ka megakaryocyte, bakit mababang platelet? It's because here, hindi siya nagdi-differentiate. And therefore, pag hindi siya nag-differentiate, hindi siya nagmamature, and wala din siyang nare-release na platelets in your peripheral circulation. And therefore, mababa ang platelet mo. Pero pinagkaiba nila ito, wala ka talagang megakaryocyte, but your autosomal dominant, you have your megakaryocyte, only that hindi siya nagdi-differentiate. So we have also here the sex-linked disorder. So we have your Wiskott-Aldrich syndrome characterized here by sex-link. Pag sabing sex-link, again, the abnormal gene is being carried by the female. And however, the manifestation of that is among male na children. Okay, kinikerry ng mother ang abnormal gene, your Wiskott-Aldrich syndrome gene. This we try to code here for the abnormal gene. And then, however here, ang manifestation nito ay sa anak na lalaki. Okay, sex-linked disorder related to your thrombocytopenia. Okay, then we have also here the thrombocytopenia among the infants or the newborn. So, neonatal thrombocytopenia usually occur here during the pregnancy when the mother would have an infection. So if the mother would have infection during the pregnancy, like the mother's been infected with the toxoplasma, cytomegalovirus, your herpes, your HIV, or even the mother tried to ingest chlorothiazide and tolbutamide. Therefore, the baby will born out of the mother. The baby will born out of the mother to have here the decrease in the platelet count. Okay, now we have here the acquired cause of the thrombocytopenia. So, like ingestion of your chemotherapeutic drugs. So, remember, your chemotherapeutic drugs try to kill not only your abnormal or your cancer cells, but as well as it also try to kill also here your normal cells, including your WBC, your platelets. So for this patient undergoing here the chemotherapy, expect that the patient would have also a decrease na platelet count because of the destruction of your platelets, because of the cytotoxic activity brought about here by your chemotherapeutic drugs. Like your methotrexate, your busulfan, cytosine. Those are your chemotherapeutic drugs. Another one, the drug anagrelide would have only here a very specific activity with the destruction of your platelet only. It will not destroy the WBC, it will destroy your RBC, but only it will destroy here your platelets. Another one, prolonged alcohol ingestion or ethanol ingestion would eventually try to decrease also the platelets of the patient. So, yung mga lasinggero, ganon. Okay, the next one, we have here your ineffective erythropoiesis. So again, the problem with your ineffective erythropoiesis, remember here that ang ating megakaryocytes saka RBC natin, so they belong to the same na cell, progenitor cell. In the case of that's specifically, that's your colony-forming unit, megakaryocyte, erythrocyte. Pareho ang kanilang colony-forming unit kung saan sila galing. Therefore, if you have ineffective na RBC production, in the case of your megaloblastic anemia, ano ulit yung mga megaloblastic anemia natin? Ano nga ulit? Your vitamin D deficiency, di ba? Your folic acid deficiency, okay, vitamin B12 deficiency, folic acid deficiency. So those are your megaloblastic anemia. Expect also have here to have an abnormal release of the platelet to your peripheral circulation, and therefore the patient would have also here decreased the platelet count with that. Okay, next we have here, so tapos na tayo doon kung bakit mababang platelet related to the decreased production of your platelets. Either problem with the megakaryocyte or normal ang megakaryocyte kaso nga lang hindi siya nagdi-differentiate. The next one, mababang platelet because of increased destruction of your platelets. The problem with this one, ulit, you have normal na megakaryocyte production normal din ang ating differentiation ng megakaryocyte, and normal din ang release ng ating platelet to your peripheral circulation. However, once the platelet is in the peripheral circulation, the platelet is being destroyed by either immunologic response or your mechanical damage or non-immunologic response. Pag immunologic response, again, the destruction of the platelet is with your antigen-antibody complex. So you are producing like anti-platelet antibody which try to destroy your platelets. Pag walang antibody or autoantibody na na-involve dito, so that become your mechanical damage. The first one, immunologic response. So, mean to say this one is the destruction of your platelets. Normal ulit, anong ulit dito? Normal ang platelet production, normal ang differentiation ng megakaryocyte, normal din ang release ng ating platelets to your peripheral circulation. However, the platelets only being destroyed by your antibody in your peripheral circulation related to the following disorder conditions. First one, the ITP, that's your idiopathic thrombocytopenic purpura. Actually, ang word na idiopathic, unknown. Unknown ang causes, hindi alam. But then I think alam kasi ito. Like for example, the case, we could classify your ITP as either acute or chronic depending on the duration of the illness. So pag acute, this one occurring here as during mga early age, so in the children. Chronic, so the try to occur here even if you're already in the adult. So pag bata ka pa, you have here several episodes of this disorder na hindi ka fully recovered, and therefore, as you try to grow older, you still have that disorder, pabalik-balik lang siya, becoming a chronic ITP. So, acute ITP here is identified as most likely related to the viral infections. Nagkaroon ng viral infections ang patient or ang bata related to either the following na viral infections: upper respiratory tract infection or gastrointestinal tract infections, where because of the viral infection, the patient tried to develop here an antibody which try to destroy the platelets of the patient or the children. So, this one would have here an abrupt onset of the destruction. Pag sinabing abrupt onset, biglaan ang pagbaba ng platelet count ng patient natin. Pag chronic naman, so again, this one occurring in the adult populations, is very common among female patients compared to the male patients. And this one would have your gradual onset. Pag sinabing gradual onset, pabalik-balik ang kanyang manifestation and becoming here a chronic manifestation or chronic ITP. Okay, now we have here also the causes of your thrombocytopenia characterized by an increase in your platelet destruction with the decreased platelet survival na mamatay siya agad related to your non-immunologic manifestation. So pag non-immunologic here, wala siyang antigen-antibody reactions. The first one, we have here thrombocytopenia related to the pregnancy. So ano nang cause niyan? Pre-eclampsia, hemolytic, this is the newborn, this is your thrombotic thrombocytopenic purpura or your Moskowitz syndrome. HUS is your hemolytic uremic syndrome associated with your infection related to your E. coli, your strain 0157H7, the EHEC, enterohemorrhagic E. coli. We have also your drug-induced related to the drug intake related to your stocytine, and we have also your hematine. Okay, now we have here the DIC. It's characterized here by, this is your consumptive coagulopathy. Other name for that is your, the meaning of your DIC is your disseminated intravascular coagulopathy. What happened here in the DIC is that you have an overactivation of your thrombin, and therefore what you have here, you have much of the fibrin clot na na-form. So as your thrombin try to act on the fibrinogen, madami na convert in your fibrin, and what you have here, madami kang fibrin clot. If you have here much of the fibrin clot, what's going to happen here, it will trap your platelet within your fibrin clot. Pag natatrap ang platelets sa ating fibrin clot, it try to consume and try to destroy the platelets. And therefore, what you have here, decrease platelet count related to your increased consumption of your platelet related to your DIC. And another mechanism here of decreased platelet count would be increased sequestration. So that could be splenic sequestration, because again, much of your one-third of your platelet population is being sequestered in your spleen. So pag tinago sila doon, sequester ng spleen, it would decrease your platelet count in your peripheral circulation. Another one, we have your kasabak merit. Okay, cold temperature. Again, in a cold temperature, diba, usual na shape natin, in a warm temperature, you have a discoid shape of your platelets. However, here in the cold temperature, I try to assume here the sphere, and this is irreversible. Once it becomes sphere, it could no longer convert it here to the normal shape, which is a discoid shape, and that would render your platelets here to be non-functional, and therefore decreasing your platelet count as well in your peripheral circulation. Another one, decrease platelet count related also here to loss of the platelet due to your massive blood transfusion.